Hello guys, so today we are going to talk about some serious issue regarding my wife's pregnancy. Uh, Frankly, in past few months we were dealing with a dilemma of sort, whether to keep the baby or not. It was due to some predictive tests, some screening tests which predicted that our baby can have some birth defects, for which we did some further testing. Those tests we will cover in this video. That includes the dual marker test, level 2 ultrasound scan, and finally the amniocentesis. So we're gonna cover all that in this video, so let's begin. So it all started at 13 weeks of pregnancy of my wife. Um, at that point, the OB-GYN asked us to take a test, which she do to all the patients. By the way, it's not specialized for us; it was for all patients. She asked all patients to take that test. That's a screening test. Basically, it just tell the probability of things, not the actual thing. It just tell. Okay, so that test is the dual marker test. So my wife took that test at when she was 13 weeks pregnant. That dual marker test. Now that dual marker test, I'm gonna brief you on that also, so that you can understand. The dual marker test tells the you know it tells the probability of having various birth defects based on the biochemicals of blood. They take the blood, and by assessing some biochemical components in that blood, they assess that if the child to come will have some birth defects or not. But they're just maternal blood, my wife's blood, that can predict that, but it's not like accurate. It's just predictive in nature. um, so we did that test, and in that test it was very high risk. It was very high risk of trisomy 21 and trisomy 13 and 18. These trisomies means birth defects in layman language. um, Actually, trisomy 21 is Down syndrome. Most of you will be familiar with what Down syndrome is. So trisomy 21 is that, and trisomy 13 and 18 are even worse. They, in short, means that a baby can't live more than 1 year of age, and that too in pain. So it's kind of big no-no, obviously. When those results came out, actually those results of this test came out when my wife was 19 weeks pregnant, due to some delay. uh, at that point of time we were given two options, because legal uh, abortion was not like, was was given as option, but as my wife was 19 weeks pregnant, so we didn't had much time to decide if we wanna abort or go further with pregnancy. So our options were three. That one option was that we do abortion straight away, like we don't go for further testing, because it was a very high risk. We won't go for further testing, and we just terminate, which we didn't took that as an option, because somewhere we believed it would be okay. My wife especially, she believed everything will be okay. She was kind of positive. Me, I wasn't that positive, because I'm a science man, and I go by the facts rather than my gut feelings. So like that. But anyways, so that was our first option. Second option was NIPT, which is again a predictive test, but that is like very accurate. NIPT is very accurate, um, way more than screening. It's up to 98% accurate. Third option was amniocentesis. That's plain yes and no. That will, like, tell if our baby will have birth defects or won't have. It will, like, it's just yes and no, nowhere in between. So that we took the third one. That um you know the amniocentesis, it's kind of expensive procedure and it's invasive procedure. um, we took that, but before that we did the ultrasound level 2 scan, and ultrasound level 2 scan came out normal. That we, like, the doc who did the scan, radiologist, she took at least 1 hour for the scan. Like, she completely checked the nose, heart, everything that was possible for her. She checked and she said, oh, everything is normal. Like, she said that, like, she was confused also, like, how come this that screening test is like that if everything is normal. So that gave us a ray of hope that if there's no visual defects in our baby according to level 2 ultrasound scan. So so then finally we made decision to go for amniocentesis. That that test was of a decision for me and for my wife and for our family, because that test carries a risk itself. Like, it is an invasive procedure in which they're gonna stick the needle in stomach and collect the amniotic fluid, that's the fluid around the baby, to extract the actual chromosomes, to study them if they are right or not. But good thing about it is that it tells about all the 23 chromosomes. So uh, we took the risk. It was expensive, it was carrying the risk, but we had limited options, so we gone for that, and we took the amniocentesis test. um, we took the test at 19 weeks and 4 days, right? We took that test at 19 weeks and 4 days pregnancy, which was very late. But then again, those tests, uh, you can see here, no significant maternal cell contamination, which means that what does that mean? Anyways, that means that you know there's no, there's no birth defect and all. It was all. So the end result was that, all 23 chromosomes are kid is normal. So the predictive test was wrong, the screening test was wrong. um, the doc who did amniocentesis, she said that that the predictive test may be due to some biochemical anomaly, that PAPPA value or something like that. I don't know, but that, and you know that thing. So the thing is, finally we got to know that our baby will be healthy, and now just we're hoping for baby at best. Now she's 8 months pregnant, and we're looking for a healthy baby. So far so good, and please guys pray for that. This video was to share our experience, and those who are going to be parents. It's a bit not a bit, it's a big responsibility. And pregnancy, most pregnancy are normal, but some of them carry complications, and even it's normal. Nobody should take it lightly. We making this video not just to share our own experience. We also want to educate other people, that some people, what they do is, once the you know once the screening test came, they are hopeless and they don't do further testing. They just go for termination, uh, which is, I think it's illegal also, just based on that. But nobody should go for termination just based on predictive test. You should go for further testing. I know it's expensive, I know it's like take a toll on your mental health and all, but then again, just if you're gonna make a decision, like, it's a human life after all, the baby. You can't just let it go by just because of predictions. You have to go for further testing. You have to just know if the baby will be okay. On the other hand, I don't know if I should say it on, but I personally believe that if baby um, will have a life of suffering, then I can't say it, but you know, just, just like hope for best, but you know, be ready for everything in life, and what's there to come, just take it. Okay, so that's all for today, guys. If you need any information regarding these tests, dual marker test, um, that level 2 ultrasound scan, and NIPT, or that amniocentesis, you can comment down below. And on based on, just, I'm not a doctor, but based on my personal experience, I can give you some info at least. So okay, that's all for now. Thank you.